The gentlelady from Minnesota, Ms. Omar.
Thank you, Chairman. Mr. Secretary, thank you so much for joining us today, for your testimony, and for coming out to my district this past February. I would like to ask you about drug prices, which is a topic of great concern for many of my constituents and much of the country. A recent AARP study found that 75 of the 100 brand name drugs that Medicare spends the most money on increased this year. And surprisingly, no top brand name drugs issued a price decrease. If nothing changes, costs to Medicare Part D beneficiaries who take an average of 4 to 5 prescriptions a month and have a median annual income of under $30,000 will increase. For many people, that increase would have a ruinous effect. As you know, Medicare currently has no authority to negotiate rebates for Part D drugs, and an average Medicare payments higher net prices for top selling brand name drugs than other programs such as Medicaid. That has the ability to negotiate prices. Mr. Secretary, if Medicare could negotiate drug pricing, how would that impact that budget?
Congresswoman, can you repeat the question itself?
Yes, if Medicare could negotiate drug pricing, how would that impact the budget?
Overall, if we're able to negotiate for lower prices and Medicare therefore is reimbursing manufacturers of these drugs at a lower cost, then it is not only a savings for the American taxpayer, but it is a boon for the Medicare recipients who right now are having to pay part of that cost out of pocket. So it's a win-win for everyone if we're able to negotiate to get the best price for the product that we know is going to be essential for these patients.
Mm-hmm. And would there be a budgetary saving for the country as well?
Undoubtedly. Undoubtedly, the cost of healthcare in America is higher than it is for any other industrialized nation in the world. One of those reasons is because we pay way too much for drugs that in other parts of the world are sold for less than what we have to pay, even if that drug may have been manufactured here in the U.S.
Right. Thank you so much for pointing that out. Not only would our country save money, but the people of this country will also have savings if Medicare was able to negotiate Part D drugs. Mr. Secretary, according to recent reports, as an estimated 122 million Americans, or 37% of the population, live in areas with a mental health professional shortage. To fill this gap, the country needs approximately 6,400 additional mental health providers. And a lack of cultural competency only further exacerbates the already serious disparities we are seeing in mental health services. How does the department's new investment in Mental Health Transformation Fund expand access to available mental health providers for communities?
Congresswoman, as you know, the president has made a request for close to $5 billion in discretionary funding and close to $52 billion over 10 years in mandatory funding to transform our mental health system. It is a budget that has never been proposed by a president before to really tackle mental health. I hope you and your colleagues are successful in helping get this across the finish line, because it will let us do so many things: provide more services, help boost the salaries of those precious mental health workers who are on the front lines. It will let us make sure we're moving towards those practices and those therapies that we know are most effective. It will allow us to actually begin to treat mental health with the same parity that we treat general health.
I hope we are successful in passing it as well. How would it address the specific cultural and social needs of populations that are dealing with disparities right now?
The president's proposals, and something we would implement at HHS, include proposals where we would try to go where the need is greatest and where we have often been absent. And so we are going to do everything we can. As Congresswoman I have said before, we've done it with the Affordable Care Act enrollment. We did it with vaccines. We're going to go to places where we've never seen our government try to push before, because we think everyone should be included.
Thank you so much, Chairman. I yield back.